Many of us wake up or go through our day with nagging discomforts. These are not just abstract feelings, they are signals from our bodies. Think about that twinge in your lower back after sitting too long, or consider the stiffness in your neck after hours staring at a computer screen. These experiences are incredibly common. We also frequently hear about shoulder pain, perhaps from an old sports injury or simple overuse. Even headaches, often tension-related, can stem from muscular issues in the neck and upper back. These are the body's ways of telling us something needs attention, a message we should try to understand better. These common complaints often point to how we use or misuse our bodies daily. Back pain, for instance, is one of the leading reasons people visit their doctors. It can range from a dull, constant ache to a sharp, sudden pain. Neck stiffness often accompanies our modern lifestyles, with increased screen time being a major culprit. Shoulder pain can limit our ability to reach or lift. Then there are knee pains, especially as we get older or if we are very active. Understanding that these are shared human experiences is the first step towards addressing them effectively and seeking appropriate care when needed. Let's talk a bit more about neck pain specifically. This discomfort often arises from prolonged poor posture. Imagine hunching over your phone for hours. This strains the muscles and ligaments in your neck. Sometimes, sleeping in an awkward position can leave you with a stiff neck in the morning. Stress is another significant factor. When we are stressed, we often tense our shoulder and neck muscles without even realizing it. Over time, this chronic tension can lead to persistent pain and even tension headaches, creating a cycle of discomfort that impacts our daily lives and overall well-being. Shoulder pain is another frequent visitor for many individuals. The shoulder is a complex joint, a ball and socket that allows for a wide range of motion. This very mobility, however, can make it prone to injury. Repetitive motions, like throwing a ball or even painting a ceiling, can lead to overuse injuries such as tendinitis or bursitis. Sometimes, a sudden awkward movement or a fall can cause more acute problems, like a rotator cuff tear. These conditions can make simple tasks, like dressing or reaching for something on a high shelf, quite painful and difficult, significantly affecting one's quality of life. So, what is actually happening inside our bodies when we feel these aches? Often the culprit is a muscle strain or a ligament sprain. Muscles are made of fibers that can stretch or tear if they are overworked or suddenly loaded beyond their capacity. Think about lifting a heavy box incorrectly. Ligaments, the tough bands that connect bones, can also be stretched or torn. Poor posture, maintained over long periods, gradually puts undue stress on certain muscles and joints, leading them to become fatigued and painful. This is why your back might ache after a long day slumped in an office chair. Our daily habits play a huge role in these common pains. Sitting for extended durations, especially with poor ergonomics, is a major contributor to back and neck pain. The human body is designed for movement, not for static positions held for hours on end. Improper lifting techniques, using your back instead of your legs, can easily lead to acute strains. Even something as simple as the way you sleep can affect your neck and back. Repetitive tasks, whether at work or during hobbies, can also lead to overuse injuries in specific areas like the wrists, elbows, or shoulders, as the same tissues are stressed repeatedly. Sometimes the pain you feel in one part of your body might actually be originating from somewhere else. This is called referred pain. A classic example is how a problem in your lower back, like a pinched nerve, can cause pain to travel down your leg. Similarly, issues in the neck can sometimes cause pain or tingling in the arm or hand. This happens because our nerves form complex networks. An irritation at one point along a nerve's path can be perceived as pain in the area that nerve supplies, even if that area itself is healthy. Understanding this concept helps doctors pinpoint the true source of discomfort. It's also crucial to recognize the powerful connection between our minds and our bodies. Stress and emotional tension can significantly exacerbate or even cause physical pain. When we are stressed, our muscles tend to tighten, particularly in the neck, shoulders, and back. This sustained muscle contraction can lead to chronic pain and stiffness. For some, this might manifest as tension headaches. For others, it might be a persistent ache in the back. Addressing stress through relaxation techniques, exercise, or mindfulness can therefore be an important part of managing these types of body aches effectively. Lower back pain is incredibly prevalent, affecting millions of people. When a patient comes to me with this complaint, my first step is always to listen carefully. I want to understand the nature of the pain. Is it sharp or dull? Constant or intermittent? Does it radiate anywhere else, like down the leg? I also ask about when it started, what makes it better or worse, and if there was any specific injury. The patient's medical history, daily activities, and lifestyle also provide crucial clues. This initial conversation helps narrow down the potential causes significantly. Following the history taking, a physical examination is essential. I will observe the patient's posture and how they walk. I'll ask them to perform certain movements, like bending forward, backward, and side to side, to assess their range of motion and see if any specific movement reproduces the pain. I will also gently press on different parts of their back and spine to check for tenderness or muscle spasms. Neurological tests, such as checking reflexes, muscle strength in the legs, and sensation, are important to see if any nerves are being affected by the back problem, which can guide further diagnostic steps. There are several common culprits behind lower back pain. Muscle strain is very frequent, often caused by overuse or improper lifting. Another common issue involves the intervertebral discs, the cushions between our spinal bones. These discs can bulge or even herniate, where the soft inner material pushes out and can press on nearby nerves. Conditions like osteoarthritis, which is wear and tear arthritis, can also affect the spine, leading to pain and stiffness. Less commonly, but more seriously, back pain can be a symptom of other underlying conditions, which is why a thorough evaluation is so important for an accurate diagnosis. Once a likely cause is identified, a treatment plan can be formulated. For many common types of back pain, conservative treatments are often very effective. This might include a short period of rest, applying ice to reduce inflammation or heat to relax muscles. Over-the-counter pain relievers can help manage discomfort. Physical therapy plays a vital role, teaching patients exercises to strengthen their core and back muscles, improve flexibility, and promote better posture. In some cases, if the pain is severe or persistent, or if there are neurological symptoms, imaging studies like an X-ray or MRI might be recommended to get a clearer picture of the spine. Let me tell you about Sarah, a 45-year-old graphic designer. Sarah spent many hours each day sitting at her desk, deeply focused on her creative projects. On weekends, she loved gardening, which often involved a lot of bending and lifting. For several weeks, she had been ignoring a dull ache in her lower back. She assumed it was just from sitting too long, or perhaps overdoing it in the garden. However, the pain gradually worsened, and a new, more alarming symptom began to develop, which prompted her to seek medical advice. The new symptom was a sharp, shooting pain that started in her left buttock and traveled down the back of her left thigh, sometimes reaching her calf and foot. She also noticed a tingling sensation, like pins and needles in her foot. This pain made it difficult for Sarah to sit for long periods, drive her car, or even sleep comfortably. Simple activities like putting on her shoes became a painful ordeal. The pain was significantly impacting her work performance and her ability to enjoy her hobbies, which was very frustrating for her. She knew she couldn't ignore it any longer and needed to understand what was happening. Sarah's doctor listened to her story and performed a thorough examination. Based on her symptoms, particularly the radiating leg pain, the doctor suspected sciatica. Sciatica isn't a diagnosis itself, but rather a term describing symptoms caused by irritation or compression of the sciatic nerve. The sciatic nerve is the longest nerve in your body, running from your lower back down each leg. The doctor explained that the lumbar spine, or lower back, consists of 5 large vertebrae, bones stacked like building blocks. Between these vertebrae are soft, cushion-like structures called intervertebral discs, which act as shock absorbers. Sometimes one of these discs can bulge or herniate. Think of a jelly donut where the jelly starts to leak out, and press on a nearby nerve root that forms part of the sciatic nerve. An MRI scan later confirmed a herniated disc at the L4-L5 level in Sarah's lumbar spine, impinging on the nerve root. With a clear diagnosis, Sarah and her doctor discussed a care plan. The initial focus was on conservative treatment. She was prescribed anti-inflammatory medication to reduce pain and swelling. Crucially, she started a physical therapy program. Her therapist taught her specific stretching exercises to relieve pressure on the sciatic nerve and gentle core strengthening exercises to support her lower back. Sarah also learned about proper body mechanics for sitting, lifting, and gardening. She made ergonomic adjustments to her workstation, ensuring her chair and desk supported good posture. Over several weeks, with consistent effort, Sarah's pain gradually subsided. She learned how understanding her body, the way her spine and nerves work, and making informed choices about her daily activities were key to her recovery and preventing future episodes, empowering her to take control of her health.